Hey, Chris Cosby here, CEO of Parkridge Health System, coming to this week's edition of What's Your Eye Wednesday. Today I have Beth Shipley with me from the MICU. Well, Beth?
Yes, sir.
Thanks for joining me.
Thank you, sir, for having me.
Absolutely. So, what all do you do in the MICU?
Everything.
Everything.
From start to finish.
The queen of MICU.
No, sir, not at all. Not at all. I like to think of myself as the reigning governess. But no, sir. We do everything that they need us to do. That's what we're there for, is to serve them. There's, on a good day, there's 6 nurses there, 12 patients there, and with that ratio, you need an extra set of hands anywhere that you can get them.
And so you just jump in there and helping everywhere you can.
Yes, sir. Mm-hmm.
So how long have you been at Parkridge?
I've been at Parkridge, Maine for 17 years now. I actually started at East in 1999.
Okay, so you've been with us a long time.
A long time.
Yeah, that's awesome. Thank you.
Sir.
So where are you from?
Chattanooga, born and raised.
Where, like Chattanooga proper, or like one of the suburbs of
I lived in Hickson.
In Hickson, okay.
Lakeside.
Do you still live there?
I do.
Okay. What's the family situation?
2 children, a 20-year-old boy, 28-year-old girl.
Okay.
Divorced, and that's about it.
You having grandkids?
No. No.
You like that was like a stern no.
No grandkids
like you got
yet.
I about to say you got the grandma thing, like stern.
You think so?
The stern no down.
Okay.
But not the grandma look.
That's okay.
No, that's just
it's
I'm
all
talking
right.
about the way you said no. But so I've interacted with you in the unit, and I always see you're always positive when I'm back there.
Yes, sir.
And I always appreciate that.
Thank you.
But we don't always have good days, right?
No, sir, not at all.
We do have some bad days, and I think sometimes we got to be driven by something internally that gets us through those bad days.
Yes, sir.
And I believe that's part of what's your why.
Yes.
So Beth, what's your why?
My why is your nurses.
Okay.
That is my why.
They're not my nurses, but.
Well, I understand that, but yes, sir, they are. It started during COVID, I guess. My little sister is a nurse, and when I say little, she's a few years younger. But she's a nurse, and she always wanted to be a nurse. I never had a desire to be a nurse. But I am a great support system. I always have been for her. And that spilled over into our nurses here at Parkridge. During COVID, our desk is kind of set like this, and there's my chair. And I started noticing through COVID that every day or so there was another chair beside my chair. And for the longest of times, I couldn't figure out. I questioned what my why was. We didn't have this then, but I questioned, why is this?
Right.
And every day, nurses would sit into those chairs, and they would just unload their stories.
Right.
And I have this knack, and it's a knack, but it's also a blessing, and I use it kind of as a ministry of my own. They can tell me whatever that they want to tell me, and they'll never have anyone come to them and say, Beth, discuss this with me.
Yeah.
I have had all kinds of secrets, all kinds of party ideas, wedding ideas. It doesn't matter what it is. They can dump it there, and they can get up and go. I'll never, ever revisit it, ask them, you know, how's this going or how's that going. Their secrets are always safe. And they have found that to be a safe place.
Right.
I love serving those nurses. I love it. It's my everyday passion to do for them all the things that I can possibly do for them.
Yeah.
They have enough stress on them. You all do. They have enough everyday, just everyday life, not even including coming to work for 12 hours. And for them to be able to just kind of lay that down whenever that they need to, I leave the chair sitting there quite often.
Yeah, awesome. I really enjoy that. I mean, I think people forget sometimes in healthcare that we have personal lives too. And we bring some of that with us every day to work. And sometimes we need that coworker that'll sit there and talk to us about the stuff. And I really appreciate that you're there for them. I mean, especially during COVID, right? We all had to question a lot of things during COVID. So
yes,
I appreciate everything you've done. And I would tell you, I know you might not want grandkids right now, but you're more than ready with you talking about how you talk to the nurses and treat them, because your grandkids are going to need that too.
Yes, sir.
So,
I understand.
Well, thank you for everything that you've done for Parkridge.
Thank
you.
I
appreciate you, and I appreciate the positive attitude I always see you with when I come back there.
Thank you, sir.
I know if I see it, I know the nurses feel it while they're taking care of the patients. They know
I hope they do.
They can trust in you.
I hope that
and it's
they do.
Nurses Week, so.
I know.
Yeah.
That was a great little thing, was that it happened, that this happened on Nurses Week, because this is their week. I've heard a lot of people say, we went and got I offered to pay for my tacos today because I'm not a nurse.
Yeah,
and I appreciate it, but we have our own little week. This is to honor them.
I do.
And I want them.
I do. I understand that. I believe in and stuff like that. There's no reason we can't feed everybody.
I know, and I know you all feel that way,
yeah.
but it's just out of honor to them.
Well, thank you for joining me today.
Thank you, sir.
And I
for
appreciate
having
everything
me.
you do for us.
Thank you.
All right. Well, guys, that's this edition of What's Your Eye Wednesday. We'll catch you on the next one.